Hi everyone, I am Dr. Sadashiv, Consultant Infertility Specialist at Milann Park and a teaching faculty at Milann Academy. We welcome you all to Milann Academy. We all know that infertility is on the rise. Even though the literature says it is 10 to 15% incidence, we see much higher incidence, especially in metro cities. So it's the need of the hour, and it is crucial for every gynecologist to understand in detail about the basics of infertility so that they can evaluate, individualize, and cater to the needs of these infertile couples. I'll walk you through the fundamentals of our 1-week Basic Infertility Course, the key skills that you'll acquire in the course, how it helps you to evaluate, diagnose and manage these couples with infertility, and the career opportunities it will open up for you. This course will cover basics of reproductive endocrinology like follicular dynamics, menstrual cycle, in-depth discussion on indications for your IUI, semen preparation, semen analysis, stimulation protocols for IUI, and all the conditions that lead to infertility like PCOD, endometriosis, even in-depth evaluation of couple with infertility, investigations for male and female infertility, and also practical exposure in the OPD on who to do IUI and how to diagnose a patient with infertility and what are the indications for IUI, practical exposure to semen preparation, analysis, stimulation protocols in IUI, ultrasound in infertility, follicular tracking in infertility, and IUI procedure per se. This course clearly stands out from other courses offered at other centers due to the extensive hands-on clinical exposure that you get about everything in infertility. Take it for example, different stimulation protocols, how to stimulate a different patient, difficult situations like resistant PCOD, how to avoid OHSs, how to treat OHSs if it is there during IUI, when to step them up to IVF, when to convert IUI into IVF, and how to take them forward. You will get exposure into counseling the patient about IUI, how to scan, how to monitor the follicles, how to diagnose ovulation, and how to detect different situations like luteinized unruptured follicle or luteal phase defect. You will also practically see semen analysis, preparation, and IUI procedure. You will get practical tips on troubleshooting an IUI like difficult stimulation protocols or difficult scans, how to do a baseline scan, how to detect different situations like PCOD, endometriosis, how to navigate a catheter when it is not an easy IUI. This course can be taken by any obstetrician and gynecologist who is keen on learning about infertility and having a basic degree or diploma in OPG. The career opportunities this course will open up for you includes you can evaluate in detail and manage all infertile couple. You can decide what line of ART this couple requires. You can decide whether you can treat her at your center or you'll have to refer. You can set up an ART level 1 clinic, deal everything related to ovulation induction for timed intercourse, do your IUIs, a semen analysis, semen preparation for IUI, and an andrologist can be there in-house. You can do all the transvaginal scanning for baseline scans and folliculometry, and you could also collaborate with an IVF center for IVF stimulations. And this course gives you a bird's eye view into how an infertility setup works, so it will help you decide whether you want to switch careers and go into infertility in depth.